What surgical approach will you use? This is something that I get asked most frequently by patients. The type of approach that I use is called the anterior approach. Anterior meaning the front of the hip, so the incision is on the front of the thigh. This is kind of the more modern approach, and most surgeons who did their training in the past 10 years typically will use this approach. Patients have liked it because there's less need for restrictions, like worrying about bending the hip past 90 degrees after surgery, or crossing your legs, or sleeping in a certain position. There's also some research that shows that patients who have an anterior approach may get off an assistive device like a cane or a crutch sooner, may have less pain and less muscle damage compared with some of the other approaches. However, the approach that you should choose with your surgeon is really based on surgeon preference and what they feel most comfortable with and in your specific situation. Patients who have complex anatomy or have prior implants from another surgery may require a different type of approach, such as a lateral or a posterolateral approach to the hip, in order to extend the incision to be able to remove or deal with that deformity. So ultimately, you don't want to try to talk your surgeon into doing an approach that they're not as comfortable with. You want your surgeon that you trust to do the approach that they feel most comfortable with for your surgery.